As an epileptologist, I'm very interested in human behavior and how it relates to people that have a potentially medical or surgically treated disease. Now, since COVID-19, we've been forced to think about new ways to communicate with our patients, to provide them with information, to provide them with the diagnosis, and to provide them with a treatment to help them with their overall quality of life. And I'd be remiss if I didn't credit my patients for teaching me the importance of this very valuable element in telehealth and the potential impact that it has on both diagnosis and treatment. My name is William Tatum. I'm professor of neurology at the Mayo Clinic in Jacksonville, Florida. I'm also the editor-in-chief of Epilepsy and Behavior Reports, and I direct the Epilepsy Center at Mayo Clinic in Jacksonville. Our article, Smartphones and Epilepsy, the New Age of Aquarius, is what I'm here to talk to you about today. A paper that will appear in the first quarter of Mayo Clinic Proceedings deals with the use of smartphone videos in epilepsy. And we likened the use of some of these new techniques and technologies to the zodiac sign of Aquarius, looking at strengths and weaknesses, likes and dislikes. The age of Aquarius is a new type of era where we are now seeing patients with increasing frequency at their request to use our telemedicine platforms and to care for them in a way that's different than has occurred for hundreds of years. So telehealth is here to stay. It's not necessarily a bad thing, and we should embrace some of these newer forms of interacting with patients to a greater degree, because it's the needs of the patient that come first that are clearly the most important things that we have in mind as treating physicians. So to provide an overview, I really have to revisit a prospective multi-center blinded study that was done that looked at smartphone videos. And what we did was, in the usual state of caring for patients, we had patients come into our clinic. We took our standard history and physical examination, and if they would be amenable for video monitoring and it would help them in their care from a clinical perspective, they were admitted for a definitive diagnosis and a final diagnosis that has video EEG monitoring, actually looking at the episode and measuring their EEG or their brain waves to provide a final diagnosis that was, in essence, a finalized diagnosis. And we're not the first ones to do this. Other colleagues of mine in neurology performing telestroke, sleep medicine, patients with neurodegenerative diseases, including Parkinson's disease, are all harnessing these ways just within the recent few years, really, to help bring our care to the patients rather than bringing the patients to the hospital, of which during COVID-19, there are risks as well as challenges that need to be overcome. So in our article, we outline the potential advantages, but also the potential disadvantages of what telehealth may do for patients with neurological impairments. But in our estimation, and one of the reasons for the editorial report, is to outline the fact that there are many benefits and many opportunities that far outweigh their risks. At Mayo Clinic, we have a different vantage in terms of looking at individuals, and we harness new ways of trying to innovate and help apply new methods that are oftentimes computer-based or that deal with artificial intelligence to kind of unravel some of the queries that remain after spending an hour with an individual in the confines of a hospital clinic. Mayo serves as a trusted partner with patients, with other colleagues and communities. And now, since the rise of Zoom and other methods of telemedicine, we're communicating in ways we've never communicated before. And I suspect we will never return, and I hope we never return, and that we learn from this experience to move ahead and use some of these innovations to try to position ourselves as the greatest healthcare system in the world, which I believe Mayo Clinic reflects. So our focus has been unique in the sense of putting the needs of the patient first. We're now following through on our mission and our vision to try to affect that by using telehealth. There's almost no country in the world that's not able to harness digital technology and have the use of smartphones. If you go to any country, you'll find them. And you'll find that the rise is continuing to exponentially increase. This is going to be helpful because utilizing medical care has had barriers. There's barriers to access video EEG monitoring units for people with epilepsy. There's barriers to acquire psychiatric evaluations and other neurological evaluations. This is all now being done by telehealth. And so our editorial concentrates on that and reports the proponents and the advances that we've experienced over the last year. And we find ourselves now accommodating not only to what we can do at Mayo Clinic, but also what we can do in the United States, impacting the entire globe. And I think we're on the precipice of being able to use that. And that innovation is going to usher in the new age of Aquarius for people that are medical caregivers, not only for patients, but for their families. Certainly those at high risk want to save time. They want to save money. Some of them don't have transportation access like the rest of us may have. And so this is a big benefit to them. This is a great benefit that we can reach out and offer them a better way. As we evolve, we will improve their quality of life by virtue of them spending less, talking more, relaying the family dynamic. Even visually, we're able to appreciate the confines with which they live, all via a smartphone. And using and harnessing those smartphones, we have access to a computer network that's a worldwide computer network. Our next line of research is going to be looking even further, looking at how we can de-identify protected healthcare information, looking at how we can transfer this data to individual physicians that can then utilize what they see in their practice to treat and measure outcomes. With the many people that we reach out to and provide our condolences for living through the most horrible time from a medical standpoint, living in a pandemic, which hasn't occurred for more than 100 years, the benefits that we can take away is that now, with the innovative use of some of these newer digital tools, such as smartphones, we've now increased what we have in our tool bag. Something that's able to be useful, not only in terms of diagnosis, treatment, prognosis, but also outcome. So our back bag is now bigger than it was 100 years ago. Thank you very much for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.